Good evening and thank you for joining us. It's going to be a tough week on the vaccine front. No new doses are arriving from Pfizer-BioNTech. The Prime Minister says he's received assurances from the company that it will follow through with deliveries when production gets going again. But a member of his cabinet and a close confidant of Justin Trudeau is hinting 2 other vaccines could be approved in the near future. But will it make up for the delay? Abigail Beeman has our top story.
I spoke with the global CEO of Pfizer, Dr. Bourla.
A conversation that didn't change the fact Canada will get 0 doses of the Pfizer-BioNTech vaccine this week.
The next few weeks will be challenging when it comes to deliveries.
According to the federal government, as of last Thursday, more than 1.1 million vaccines were distributed to the provinces and territories. And according to the Global News Vaccine Tracker, by Sunday, a little more than 800,000 of those were administered. On the world stage, Canada continues to drop in terms of vaccine rollout, now ranking in 18th place, right behind Italy and Romania.
Extra beds is like a Band-Aid. What we really need is the vaccine.
We are in an international competition for a very scarce resource.
On the West Block with Mercedes Stephenson, the Minister of Intergovernmental Affairs said the government is trying to get Moderna doses earlier.
Whether they can bring forward some doses that may be coming in April, could we get them in March? Some of the ones that were coming in March, could we get them in February? So those conversations are ongoing literally on a daily basis.
Dominic LeBlanc also hinted at a timeline to approve the next 2 vaccines.
We're very hopeful that in the coming weeks, other vaccines may be approved by Health Canada as safe for use. AstraZeneca, perhaps Johnson & Johnson thereafter.
Coming weeks for the 2 vaccines under rolling review by Health Canada. Both are more traditional vaccines than the new mRNA technology used for Pfizer-BioNTech and Moderna, meaning the world could produce more fast.
They can use industrial processes that we already have a pretty good handle on. They're the type of things that can be made in large batches and for lower cost than something like an mRNA vaccine.
Canada's top doctor is asking all Canadians who are vaccinated to keep following guidelines, including mask use and physical distancing, in part because Dr. Theresa Tam says while the vaccine will stop you from having COVID-19 symptoms and getting sick, we still don't have enough evidence as to whether it stops you from transmitting the virus to someone else. Abigail Beeman, Global News, Ottawa.
Get set, go!
People across England spent the day enjoying a rare snowfall despite current lockdown measures. Parks were filled with kids and some adults sledding down hills. Many people were not wearing masks or physically distancing, but at least one snowman spotted near Buckingham Palace was sporting a mask. The snowfall forced several COVID-19 testing and vaccination centres to shut down. So far, more than 6 million people across the United Kingdom have received their first dose of the vaccine. Our Europe Bureau Chief Crystal Gomansing has a look at the race to vaccinate in the UK and around the world.
From cathedrals to cinemas, vaccination centres have sprung up around the UK.
Strange, but it's strange times, isn't it? Nice and open, plenty of space for everybody.
Boris Johnson's government is aiming to vaccinate 15 million in the over 70 and high-risk group by mid-February. The urgency more acute now that there's some suggestion the UK variant may also be more deadly.
Like in Canada, there are also supply issues here. Some communities are having their vaccine shipments diverted to other neighborhoods. The goal is to balance coverage, but it is frustrating for people.
If we think about this as being kind of a wildfire, if we're all kind of going at this with with our individual jerry cans or our hoses and trying to kind of put things out piece by piece, we're not going to make a lot of progress. I think we have to think about this as being a non-competitive race.
In countries with robust vaccination campaigns, the UK and Israel, for example, infections, hospitalizations, and deaths remain very high. Researchers in Israel grabbed headlines saying early data from some older individuals vaccinated with the Pfizer-BioNTech vaccine suggested single shots may not provide as much protection, possibly only lowering the risk of infection by 33%. Pfizer-BioNTech has not released any single-dose data. Its trials were based on 2 shots. The comments have since been refuted by Israel's Minister of Health, saying the information was taken out of context and that more time is needed for the vaccine to take full effect. Still, officials in Quebec took note. They're watching for more information, but for now, the province's vaccination strategy is not changing. The problem is there's little concrete data. Research is ongoing.
It's been somewhat frustrating, I think, for most of the research community kind of watching this kind of science by press release.
Teams around the world need time as they work to sort out questions about vaccine effectiveness and the role coronavirus variants play. Public health experts continue to say vaccines are a key tool, but not a silver bullet, stressing the need for people to take precautions.
Still keep yourself safe, follow all the guidelines.
If I stay indoors much longer, I should go stir crazy.
It's for everyone's safety.
Being safe will keep the virus from spreading. Crystal Gamancin, Global News, London.